Older children are often in a hurry and at times swallow food without fully chewing. These situations can often lead to choking. In a primary assessment, you learn how to apply the cycle of care to ask two initial questions when a child is in need of emergency assistance. Is the child's airway open, and is the child breathing normally? When a responsive child is choking, they neither have an open airway nor are they breathing normally. A choking child needs immediate help to restore breathing. Let's learn how to help a conscious and unconscious child expel an object that's causing her to choke. If you believe a child is choking, begin with scene assessment. Stop, think, and act. Since you're not likely to have contact with body fluids and time is important, you usually do not need personal protective barriers. Ask a responsive child, "Are you choking?" If the child is coughing, wheezing, or can speak, encourage the child to cough until she expels the object. If the child cannot speak or breathe, give the emergency responder statement and alert emergency medical services.
Are you choking? My name is Joss and I'm an emergency responder. May I help you?
After the child indicates she wants your help, a nod will do. You may use back blows, abdominal thrusts, or chest thrusts to attempt to dislodge the object. Techniques for handling a conscious choking child vary internationally. Your emergency first response instructor will teach you the techniques appropriate for your area, and it's those you should use when assisting a choking child. In general, however, there is no clear evidence that one technique is better than another, but there is evidence that if one technique does not help a choking child, another one might. To deliver back blows, take a position to the side and slightly behind the child. Supporting the chest with one hand, lean the child forward like this. A small child may be placed across your lap like this. Next, while supporting the child, deliver 5 sharp back blows between the child's shoulder blades using the heel of your hand. Continue the 5 back blows until the object is expelled or the child becomes unconscious. The aim is to relieve the obstruction with each back blow rather than to give all 5 back blows. After delivering the back blows, look in the child's mouth and carefully remove any visible objects. Abdominal thrusts use residual air in the child's lungs to blow the obstruction clear. To begin, stand, sit, or kneel behind the child with your arms around her waist. Find the child's navel with one hand. Make the other into a fist and place the thumb side against the child's abdomen slightly above her navel like this. Put your other hand on top of your fist. Bowing your arms so you don't squeeze the child's ribs, pull your hands inward and upward in a thrusting motion. Continue the 5 abdominal thrusts until the object is expelled or the child becomes unconscious. The aim is to relieve the obstruction with each abdominal thrust rather than to give all 5 thrusts. Another technique used to assist a conscious choking child is chest thrusts. In some regions, chest thrusts may also be used on children who are markedly obese instead of abdominal thrusts. To begin to deliver chest thrusts, stand, sit, or kneel behind the child and place your arms around the body under the armpits. Place your chest against the child's back. Locate the chest compression site. This is the same compression site as CPR over the lower third to half of the sternum. Next, make a fist and place the thumb side on the thrust site. Place the other hand over the outside of the fist. Perform up to 5 quick inward thrusts. These thrusts are similar to CPR compressions, but sharper and delivered at a slower rate. Avoid putting pressure on the rib cage with your arms. Continue the 5 thrusts until the object is expelled or the child becomes unconscious. The aim is to relieve the obstruction with each chest thrust rather than to give all 5 thrusts. Continue using one or more of these techniques until the obstruction is relieved or the child becomes unconscious. If a responsive choking child becomes unconscious while you're trying to help, carefully help the unconscious child to the ground. Next, if you have not already done so, activate emergency medical services and immediately begin CPR, chest compressions. The compressions may dislodge any obstruction. After giving chest compressions, you should quickly look inside the child's mouth to see if there is any solid material visible in the airway. If an object is seen, you should remove the object with your finger. If no object is seen or the object has been removed, you should proceed with 2 rescue breaths. Finally, continue to give 30 compressions followed by attempting 2 rescue breaths, just as you've already learned. Continue CPR until the obstruction is relieved and the child becomes responsive or emergency medical services arrives. When you practice these techniques in class, be sure to simulate thrusting. Never perform thrusts on a child who does not have an obstructed airway.